Many of these newer tooth creams, Zen CP, Remin Pro by VOCO, have levels of fluoride above that of toothpaste. Our common toothpaste has 900 to 1,000 parts per million. We now see Zen CP, Remin Pro 1250, Remin Pro has 1450, getting to the levels of those Clin Pros and the Prevident 5000s, which we have seen in the past from the research has a lot of benefits for our patients. All of our governing bodies that the efficacy of a varnish is much better for our patients than those foams and the rinses. There might be a place for a foam and a rinse when somebody may have a disability or you can't have them open a long time. Whatever type of fluoride therapy gets to that patient, I would be happy with. But if we're talking about our average patient, it's the varnish that I would want to push with them.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Hey everyone, this is a special bonus episode of A Tale of Two Hygienists, and a special thanks to you for listening to this episode that we did with Dr. Bill. We have so many patients who have recession and xerostomia, and while he was talking mostly about our elderly patients based on the lecture that he gave at Under One Roof, there have been so many 20 and 30 some odd year old patients that I've seen in my chair that present with the same issues. So his message today is universal. And we talk about some pretty good stuff here with some home care instructions and products, billing procedures, Canberra, caries assessments. It was really, really fun. We recorded this at Under One Roof in July, so you will hear a bit of that excitement in the background. It was too hard not to have a great time. Thank you to Erica Flateau, who you're going to hear as our co-host again for this one. And she made a really great connection both before and after the recording with Dr. Bill. So thank you so much to her for that. And of course, thanks to VOCO for sponsoring Dr. Bill on this episode. Thanks again for listening and enjoy this week's bonus episode.
A tale of two hygienists.
All right, welcome everyone into the interview portion of the podcast. We are live on the exhibit hall floor in the RDH Under One Roof again. I feel like we've done a lot of these episodes here. You're going to hear a little bit of the background noise, the excitement. We have cornhole right here, so you might hear some thuds from the beanbags in the boards over there. But we are joined today by Dr. Paveletz, Dr. Bill, and thank you so much for being here.
Thank you for inviting me.
Yeah, so Dr. Bill, you were telling me before we started recording here that you gave a lecture, you were speaker here at the convention.
Yes, I was, yes.
And it was called For Mature Audiences Only, I was very intrigued.
Yes. Well, I found doing this for the last 6.5, 7 years, you have to get a catchy title to bring them in. And keeping it a little, racy is, the hygienists like it. But, the course was based on dealing with our aging patient pool and what types of therapies that we can offer them and utilizing therapies that we currently use in adolescents, and I'm talking about fluoridation and varnishes and tooth creams, and allowing the audience to kind of expand their mind on how to bring up that conversation with your patient, with your office team, and also utilize those tools, Canberra, Caries Dental Assessment by the ADA, both great tools. I was surprised that there was a small group of hands that went up about caries assessment, but the Canberra had a little more hands up in the air. And trying to engage the audience in the sense that, why did you stop using it? Did you go back to using it? And were you kind of not knowing how to use it? So the course was, based solely around that and talking about the risk factors and what conversations the hygienists are having with their patients.
Right,
So,
and those conversation starters too.
yes.
How to approach them, how to really get into this and care for your patients the way you want.
And Erica, I agree with, there has to start somewhere with a question. But many of the audience members were asking a question that only gave an answer, yes or no. And I think if you give an open-ended question in the sense that, here is fluoride therapy that we use and not a fluoride varnish, and why we're suggesting this choice of protocol, kind of opened their minds. And several of them were using their own terminology on how to do it. Yes, it's a therapy that has fluoride in it. They didn't want to talk about a fluoride treatment. It's a therapy that has an added bonus of fluoride in it. So many hands went up. How they feel like, do you argue with the patient that Karen who doesn't want to introduce fluoride to her kids or her family, but it's something that's around us all the time. And the hygienists were kind of giggling there that depending on the time of the morning, do you open up that argument about the benefits of fluoride treatment or therapy? Or can you give them your key responses to say, well, I want it. Mm-hmm. And it was interesting, their feedback, very much so.
So caries and dry mouth in this aging population.
Well, dry mouth, I mean, as you walk the floor of under one roof, there's multiple manufacturers here that are focusing on dry mouth. Not only for the aging population, I like to say seasoned, going to be 58 years old. It's like, okay, I'm not aging that quickly, but seasoning is better. How to address that, the dry mouth? They're taking medications, antihistamines, antidepressants, antispasmodics, all of that.
High blood pressure.
High blood pressure. All with a side effect of dry mouth. And because dry mouth is one of those characteristics that are associated with tooth decay, dry mouth, pH levels that are acidic, all of that plays into factor. And as I walk the floor and I see the manufacturers offering dental tooth creams, as I like to call them, not toothpaste. These tooth creams can actually be brushed on instead of being an abrasive agent like some of the toothpaste out there. So
I was actually just going to ask about that because a tooth cream does not mean the same thing as dentifrice. Right? We talked about that
correct.
In school.
Yeah.
And so tell me a benefit of a tooth cream versus a paste.
So depending on the formulation, everything is now being reformulated, reintroduced. Seeing certain toothpaste have an abrasiveness to it. Mm-hmm. And you use a toothbrush with it. There are certain items, I should say, products for dry mouth or for combating pH levels that you have to apply it with a clean finger. You can't use a toothbrush because there's amount of silica that's abrasiveness. And
sure.
Many of the tooth creams actually have an added bonus as a desensitizer. Mm-hmm. And everybody has an issue with sensitivity issues, whether it's cold or hot, eating your favorite ice cream. We're now dealing with that. Mm-hmm. So when I speak to an audience or a colleague, I use my words carefully. It's a tooth cream. When you think of tooth cream, creaminess, you put cream on your face, they can brush with this, but it still has the benefit of the high fluoridation materials that are out there for desensitizing and for helping in regards to demineralization and remineralization.
And I apologize for being maybe a little bit dense on this,
no.
But because when tooth creams, it just hasn't really kind of come into my orbit, so to speak.
Right.
So are you saying that this is something that you'd use instead of a dentifrice, or you'd use a dentifrice and then a cream separate?
That's a great question. So many times our patients feel there's multiple procedures. You got to use a desensitizer on a clean finger. It may have a milk peptide in it that helps it stick to the surface. Others you can brush with, so you can substitute the toothpaste or the dentifrice with that agent. Many of these newer tooth creams, Zen CP, Remin Pro by VOCO, have levels of fluoride above that of toothpaste. Our common toothpaste has 900 to 1,000 parts per million. we now see Zen CP, Remin Pro 1250, Remin Pro has 1450, getting to the levels of those Clin Pros and the Prevident 5000s, which we have seen in the past from the research has a lot of benefits for our patients. But then there's also the maintenance schedule, putting them down once they've achieved a level of health there in the oral cavity. We can then put them on a daily maintenance instead of bombarding them with higher dosages of fluoride, which everybody seems to be concerned about, the amount of whatever we're putting into our bodies.
Well, one thing that I haven't really thought about until you just tell me about these tooth creams, the aging population, a lot of recession. The surface structure of your enamel is going to be very different than your cementum, right? So how does that interface play differently?
So in regards to the approach of a tooth cream with the aging population or the geriatric population, that exposed root surface a lot of times can be very sensitive. Cervical decay on the tooth itself, that interaction. Applying that higher level of fluoride gives them the added protection. And as we age, things start to dry up, unfortunately. And, salivary glands, they don't produce as much saliva as before. And many of these tooth creams actually generate saliva and help with combating that dryness in a patient's mouth.
Well, and I think part of your program, too, was speaking to how to institute this type of protocol and how to get it paid for.
Correct.
Yeah.
And interesting enough, Erica, the tides are shifting with coding. The ability of using, the code, CDT 9630 for a tooth cream, like a Remin Pro or an MI Pace Plus, the insurance carriers are looking at it differently. Though just because they have the code doesn't necessarily mean there's going to be full coverage. And the conversation opened up to the sense that what are you doing additional when you're speaking with these patients? Are you doing a pH level or a litmus test? Are you taking salivary flow measurements? All of that are like secondary procedures that kind of confirm with the dental carriers, wait, they're addressing the disease. And that's what we have to talk. I mean, this caries is a disease, and we're looking at it differently. And if the hygienist is taking a different approach by measuring, there's very low, moderate to low salivary production, and their pH levels are off, it justifies their therapy of offering them the tooth cream. And many of the audience members kind of like perked up and said, I never thought of it that way. And we don't, because we always think of it as just one runway going right down there, and that's not what or how we should approach it.
Well, I think sometimes too, like when you're, especially working with insurances, we just do what we do. We know what's going on. We see what's going on. This has been the way that we're going to fix the problem. But then we're like, oh, now we're playing with this, third party that doesn't quite understand, that needs verification. They need some sort of objective test to justify then to the powers that be that to pay out for these
and that's
procedures.
so true, because when they look at it, all they see is a code. And if they don't, the person processing that claim or the hygienist giving the information to talk about why did they do it. There's a remark box that they can talk about. They're at certain risk. And, I mentioned, drug usage in the sense that we're taking it for antihistamines and antidepressants, but also people that are recovering from narcotic abuse or alcohol abuse, multiple restorations in their mouth, surface restorations that put them at risk. We're all enjoying these late night dinners, restaurants having, Italian at 10 o'clock at night. Those acids don't play nice. And also on their stomach, and that regurgitation of the acid, we're seeing it in our patient's oral cavity. So there's a laundry list to actually look at when you decide on whether or not you should recommend a tooth cream to your patient.
Yeah, that's interesting.
Yeah, and of course we're not going to let insurance dictate what we recommend. However, if we can get a benefit for a patient, that's great. So you were speaking about medical as well.
Yes. So the things have shifted to the medical. We see now physicians' assistants, nurse practitioners, even doctors themselves at a child's wellness visit are allowed to use a fluoridation therapy, like a varnish.
Sure.
Because they see the need for it. And as I stated, it is a disease. So if we can tell that carrier, whether it be dental or the medical side, we're seeing the use of, fluoride varnish, a code 99188, in the medical portion of it.
Mm-hmm.
And from past experiences with audience members, some offices are getting a return from the medical portion of a fluoride therapy, $75 to $95. And looking at your expression there, you would probably say, really, I can get almost close to $100 for something that our profession, CDT, in regards to the dental benefit carrier, puts a cap of $39 for a fluoride therapy.
It's super frustrating.
It is.
And especially, not to get too much in the weeds on this, but we have hygienists working on production models that we have our UCR fees, and then we're taking these low insurance reimbursements.
Yep.
That it really just impacts me, the hygienist, in the long run, trying to take care of my family.
Exactly.
Yeah.
And, let's take insurance out of it because, a lot of times they think it's insurance, it's money owed to them, and it's really a dental benefit.
Thank you. Yes, that's true.
And it's our words really help when you say that to a patient. But as I said, they'll spend $9.95 for a Starbucks, or sorry, I'm not putting any label on it, but a triple shot macchiato. And yet, when we offer them a fluoride therapy that will benefit them for less than $10, they say no.
Yeah.
And, we have to say, wait, you've invested all this money on your veneers, some of the implants where teeth were missing, and ortho.
Yeah.
I mean, orthodontics, whether it's fixed or removable, tooth creams. Nobody wants to spend $6,000 and then see white spot lesions around the bracketing area where,
So let's protect that investment.
Exactly.
Yeah.
So, the conversation open, why not include that? Just don't even offer it as a price point. Put it into their treatment. And what they don't know, they won't miss, but yet they'll use it knowing the benefit of it.
Well, and insurance is really a misnomer because, insurance, something catastrophic happens, they just pick up the bill, right?
Mm-hmm.
I mean, dental insurance, that's just a joke because it's, it's like a gift card every year towards your treatment, basically.
And that gift card is only worth $1,500
Still.
when you look. It's still, still, as seasoned as am I, and I remember it for the decades. And Crown and Bridge, fixed, removable, whatever. Those prices have definitely kind of gone up. Nobody's said, "Oh, I'm going to lower my, a PFM porcelain." No, it's not going to happen.
So if a hygienist is here with you today and you have some great ideas and they say, but my patient's going to say to me, okay, but why now? I've been seeing you for 10 years and now all of a sudden this is something you're instituting.
Well, what we look at is as time changes and the research that has been put out there, I am at the age where the generation, we had foam fluoride treatments. I remember just hanging there with that little tin under my chin, not swallowing it, but half the time I did swallow it, and dripping out. The efficacy. We know now from ADHA, RDH, all of our governing bodies that the efficacy of a varnish is much better for our patients than those foams and the rinses. There might be a place for a foam and a rinse when somebody may have a disability or you can't have them open a long time. Whatever type of fluoride therapy gets to that patient, I would be happy with. But if we're talking about our average patient, it's the varnish that I would want to push with them. So.
For sure. Well, I feel like I remember we were in school, my brother and I, and we, and I'll tell you, it wasn't that long ago. It was, 15 years or whatever. We had to justify the use of which type of fluoride we're using for our patients.
Mm-hmm.
So what you're talking about is really not that old. Like this is
not at all.
And it was always like, okay, guys, in pediatrics, you're going to go ahead and use varnish all the time. But with the adults, we're going to go ahead and use the foam.
Right.
Oh, it's so annoying.
Yeah.
We had to write a paper. I remember we had to write a paper of, we quoted RH Magazine. We said, these are the high carriers risk patients that we need it for. And we're doing Camber basically, 15 years ago.
And and some of the statistics, I actually bring that up where the efficacy of that varnish, when you're looking at adults, 50 to 70% higher results with using a varnish. It's less than 35% with the foam with the adult. Yeah. And, we have that ongoing battle. They don't like the stickiness on their teeth. They can't go out for cocktails after the varnish treatment because the alcohol breaks it down. It's a give or take. And the benefit of it is you're going to keep your teeth, right? I always use the analogy, you always have one summer in your practice. Some of her teeth are here, some of her teeth are there. And you look back and they say, I would rather pay $25 for an extraction than putting a little more effort into restoring that tooth as best as possible. So I use humor a lot, but it drives the point home with the audience, and they can relate to it.
Can we go back to the medical insurance for a quick second?
Sure.
And again, I don't expect you to be a guru on medical insurance, but if you are, that's awesome
No.
too. So I feel like I'd go to my office and I would say, hey, can you submit to medical for this? And they would just look at me and be like, that's not going to happen. Nice try, buddy. What does that process even look like? How do I get my team on board?
So the process is, and to base this, I am not the expert on coding. I actually go to the expert, and that's Kathy Forbes. She put together for our company a handout for our audience members that talk about narrative. She touches upon the medical side of it for the office to have some additional training. It's not that difficult, especially when, your doctor is an ADA member, and using the right medical codes and picking up the phone and talking to those medical benefit carriers that you may know of from your patients and say, here's our situation. Our patient does have a disease, moderate to high risk care, chronic. And we're trying to treat it. We know the benefit of using the fluoride varnish. Maybe it's a moderate to risk perio patient. And, I'm seeing the patient quarterly and we want to evaluate how can I submit this to their medical benefits, because we know that the dental benefits will not cover it because of their age. They're already over the 21 years of age. But with the medical, they're not questioning it. And it's documenting it, as Kathy Forbes always says. Document it, know what you're dealing with, and give them an image, because, John or Sue at insurance carrier X is only looking at numbers.
Yeah.
But there is a remark box that you can elaborate on and tell them a bigger story.
Is that handout available for the people listening to this as well?
Sure. That can easily be on the VOCO website, or we can put it on on Under One Roof.
We'll put a link in the show notes even too, if that's easy enough to
Definitely.
get from. Okay,
It's
that'd be
easy.
great.
It's a QR code, and it's amazing. I know that the phones go up at the end of a lecture because they're looking for their code for their credits. But when I put that QR code up for, if you want to kind of look through this document, it's easy to
I love it.
right from a Dropbox. So
Awesome. Well, it's been absolutely wonderful getting to talk to you today. And I
Well,
know
thank you.
that with your humor, I'm sure that you made a lot of hygienists laugh. And it's part of what's fun about coming here.
Well,
Any
thank you.
closing remarks? Anything else you'd like to share?
I think, it's something when I say for our listeners that we have to keep an open mind about it. And we got to get uncomfortable from being comfortable about statements. And, open the dialogue with the patients. You got to listen to them and see what or how you could help them. And it's as simple as some type of fluoride therapy that does wonders. So,
Great. Wonderful. Well,
Thank
you
you.
very much. Thank
Thank
you so
you,
much
Doctor.
for
I
coming
appreciate it.
appreciate it. Thanks.
Dr. Bill.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental dental knowledge, and we do it all with ease. We cover oral health and screening and preventing gum disease. We're gonna do a lot of learning and have a little bit of fun working at the dentist. A tale of two hygienists.